Soft tissue release for pectoralis major. Beginning with the client in a supine position. For a passive STR, we want to be able to move the arm, so it's important we hold the arm in a nice, comfortable position. So you want to take hold of the client's elbow and ask them to hold onto your upper arm. And now, as you can see, I've got full movement, so I can rotate from one side to the other side to create a stretch on the tissue with ease. So if we're working on those fibers to begin with, we can shorten, bringing the elbow down towards the midline. We trap and then we stretch away, moving the arm away. So I'll show you that with the cloth. So we shorten, bringing the elbow down towards the midline. We trap with the fingers, so using the fingers as an applicator, and then we stretch away, moving the arm away into abduction. Now remember, the pectorals do lots of different things, and now we can take it more into horizontal extension. So we shorten, bringing the arm up into more flexion, trap, and then we go down into horizontal extension. So I'm just drawing and dropping my body down just slightly. We can do an active STR, but this time we still hold to support the client's arm, and we just get them to do the movement, but we're guiding them. So we're holding onto the elbow so they haven't got to maintain the position of the arm and then move the arm up. And here we can move on to the sternal attachments of pectorals. So we can start higher up towards the top of the sternum. We take our lock across the body, going away from the sternum towards the pec. And then to get the active soft tissue release, we ask the client to take a nice breath in. And then we can work the length of the sternum. So we can use the cloth for the same thing. So we shorten, take the tissue away from the sternum to trap. And we ask the client to breathe in to create that stretch. And then we can move into more of the clavicular attachment. So coming down away from the clavicle, we take the lock and we ask the client to do that nice breath in again. So we shorten, so working along that clavicular attachment and taking that nice breath in. So by doing this, we're also doing an STR for subclavius. So both subclavius and pectoralis major can be worked through the STR in this position. So we can work along the whole length of the sternum, but what we want to do is we work down towards the chest. We're going to work through a towel. And we ask the client to just point to demonstrate where their sternum is, so we know we can go into the right place exactly with that feeling around the area. So same thing, we take the lock away from the sternum and ask the client to take that nice big deep breath in.